Dr. Kalaniak, and we're going to briefly discuss the diagnostic history, how to be successful. Let's get started. The most important thing for you to understand is that learning how to diagnose a patient is hard. Of the 328 million adults in the United States, we have 953,000 MDs and DOs, 115,000 physician assistants, 36,000-ish nurse practitioners. That's a total of 1.1 million individuals who have undergone and learned how to diagnose patients. But that's only 0.33% of the total adult population in the United States. Why is that? It's because it's hard. If diagnosing diseases was easy, we would be able to design and program a computer to do this by now. We land on the moon, we land on Mars, but yet we can't get a computer to help us diagnose individuals. That's because your brain really has to pull in so many different facts, put it all in the context of different DNA backgrounds, and come up with a diagnosis. The one thing you should know is that every individual who has learned to master this skill found it hard at the beginning. They did not get 100% everything perfect on their first, second, third, fourth, 10th, probably even 20th patient. It is something that takes time to master, but it can be mastered, and it's important that we do master it. The reason being, the IOM report of 2015 found that 48% of human medical errors could be traced back to us missing something in either the patient's history or on the physical exam. So it's a totally preventable medical error. So the real question is, how do I keep from making that mistake? And the most important thing we found, and you will find it in all of the physical diagnosis textbooks, Bates and Seidel, is the use of a structured history. It might seem restrictive at the beginning, but it will save you from being one of those 48% of individuals, or one of those that makes one of the 48% of the medical errors. So let me show you how to actually do it simply. We're going to identify who is my patient. We're going to ask 2 open-ended patient-centric questions. We're going to use the history note card that we've given you in our simulation to help you remember all the things you should characterize in the history of present illness. We'll go over past medical, family, social, and that review systems will keep you from missing something critical. So let's get started. We're going to start with Marvin. He presents with fatigue and cough, and we press the start button and let's get started. Remember, each of the patients in this simulation started out as a real person, treated by a real clinician. Hence, if your patient refuses to answer a question, guess what? They refuse to answer the question to the clinician. So the clinician can't put and make up an answer just to make it easier for you. If the patient was snarky, the patient was snarky. So we're trying to capture reality. You will be presented with a lot more challenges that are probably a lot more difficult than what you're going to see in this simulation. The good news here is make all of your mistakes here. We will copy every single thing you've done. We'll give it back to you. You can review it and not make that same mistake again. I just wish I had this type of program when I was learning. I really feel I should be sending out apology cards to all of my first patients along the way, because they were so patient with me when I really didn't know what I was doing. So I'm going to write down fatigue and cough. This is what the patient told me at the get-go. He says he's feeling lousy. I close down the observation. His skin is warm and dry. I only write down the abnormal findings here. I'm then going to look at the chart, just like I would do in the real clinic. And just like in the real clinic, somebody's taken vital signs for me. So I will look at them, and although the fever isn't quite at the level we would call it, which is 100.4, it's close enough. I'm going to mark it down. I'm going to look at his previous chart and get a sense of who he is, what kind of problems. He has a history of childhood asthma. Asthma can sometimes start with a cough, so I'm going to write that down as a risk factor. So I write down Anything out of the ordinary in key findings, anything that puts you at increased risk for the symptoms that I'm seeing here, so that I can start compiling all of the information. And we call it sort of chunking it into body systems. Asthma, cough, that sort of sounds like the same respiratory body system. I would go through the whole thing. If we go down to the management plan, we find he deferred his flu shot. Same body system of respiratory, so that must be some critical piece of information. Whether it plays a role or not, I don't know. I'm just collecting information early on. The history is all about information gathering. If I've done a good job, 80% of my differential diagnosis will come from what I've collected in this history. So now I'm going to start with my 2 open-ended patient-centric questions. I have the interview opening folder here. How can I help you today? As soon as I get good question, I know I've got one of the key questions that the author felt I should ask. And I've also learned he has body aches. I'm going to ask the next open-ended patient-centric question, any other symptoms or concerns? And I get another hit. Another good question, another point obtained. And I see that he has a sore throat and a headache. Now, these are my notations. I try not to do typos, but it is, shorthand is totally acceptable. At this point, you know, if I wanted to do a mini mental evaluation, I could do that there. Notice that your professor, if I were playing a student at this point, has given me 80 questions. It's telling me I've asked 2. My professor has also said that I'm going to be able to determine whether I've asked a question before, but I can ask it again. Notice I started with 2 questions. I ask it again, I'm up to 3. So if I don't remember the answer, that's one way to get it, but I lose my question. Another way would be to go to show dialogue. And if that is available to me, not all professors make that available, but if mine did, in order to help me, I can always go back and review things. Let's ask a few more questions, maybe about the cough. I can go to cough and ask when. That's an old cards question. So if I go to history, no cards, I can start completing it. He has a cough. It started, that was actually something he told me at the beginning. And when I asked onset, he said yesterday. So I'm collecting information as I go. I can make it, you know, larger so that it's easier to see. I can minimize it. I can completely close it and then reopen it. The more I fill out this history note card, it's now saying, well, the location, I sort of know that's probably not, you know, it's the throat. Duration, it started yesterday. That's also of short, but I might want to ask, you know, is it dry? And so, oops, I don't want to put it there, but I might ask here, how severe is your cough? And it's annoying. So if I go down here, I would just put down that it's annoying. So it doesn't look like it's that severe. Are you coughing up any sputum? No, it's definitely dry. So again, each of those pieces of information is helping me decide bacterial versus viral in thinking about things. Onset, is it acute or chronic? All really critical pieces of information for me to understand what's going on. If it's easy to relieve the symptoms, that also decreases my concern. So does anything make it better or worse? And I said, not really, but it doesn't sound all that bad. So you can see how I'm working through my old cards questions. If I think I'm done with everything, I would go first, though, through all of my history of present illness for each symptom. I would then go to my past medical history and get allergies, update that. I would update current medications. Are you taking any prescription meds, and are you taking any over-the-counter meds? Now, when I looked at his chart, he was not taking any medications, but people borrow prescription meds. They change what they take over the counter. So I always check it. So I've given you 5 free points: 2 open-ended patient-centric questions, allergies, prescription meds, over-the-counter medications. Do I do this in real life? Absolutely. If I'm ever going to be prescribing a medication for a person, I am responsible for having asked those questions, making sure they're not allergic, and making sure there's not a medication conflict. I take that very seriously. That's one of the major reasons we have medical errors is people forget to ask those kinds of things. Social history, I would definitely look at his social history. He went from living at home to living in the dorm at college. I don't know about you, but there were big changes in my social situation during that time. And then I would start with the review of systems. And you've got 13 body systems. I usually do the top 5 or 6: heart, lungs, central nervous system, stomach, GU, and skin for the focused exam, which is what it appears he has, since I have a chart and he was seen less than 2 months ago. When I'm done with all of that, I can, if my professor has given me this button, look at history hints. You can see there's about 30 questions for a focused exam, and it's telling me, well, you've got a whole bunch more questions. You need more characterization of all those symptoms. Well, we didn't really even scratch the surface there. 1 more in past medical and 5 in the review systems. I told you those 5. What's the 1 in the past medical history? Well, remember, he deferred his flu shot. If we go to past medical and we look at preventative health, sure enough, there's the flu shot. And sure enough, that was the other point. So you can see with this, we're giving you lots of assistance. How much assistance, how many of these buttons you have is totally dependent on your professors and where they think you are in the whole concept of diagnosing patients. If they think you're really good at this point, they might remove this file folder system, and you might have to type every question that you want. So again, the more structured you are in knowing I'm going to do old carts for every symptom, the faster you'll be able to get this accomplished. If you don't like typing and you use the Chrome browser, you could just click on it, the microphone, and speak your question. When did your headache start? And again, how many options are brought up with our natural language processor? That's a decision for your professor. Usually we recommend anywhere from 3 to 10. This is set up at 5. So I hope with those tips, you'll become a superstar. But remember, it took all of us many, many patients to learn the process. So take the time, review it, try it, review your success, note to self, and then try it again. Good luck.